Hi everyone, I'm Rita, nurse prescriber and lead trainer of Deja Aesthetic Training Academy. I'd like to talk to you today about the importance of how to handle aesthetic complications. How can you avoid? How can you recognise? How can you manage and treat them? Of course, we do teach the complications relevant to the courses on the training day, but not in the detail you require as you progress in your journey. Mastering complications requires a whole day course, and of course your own practical experiences. I truly believe that we should not be practicing aesthetics unless we fully understand the possible complications that could arise from our treatments and how to manage them. It's happened to me and I'm sure it will again. I can remember how I felt. I felt sick, anxious, sleepless nights over something bad happening, and it was my fault. Waking up in the night and worrying, mind going into overdrive. Is it worth the worry? Shall I give up aesthetics? Will they make a claim and sue me? Will it damage my good reputation? Fear of not knowing what to do. Have I put my client in danger? God, what have I done to their face? Maybe you think that reading about complications and looking at videos is the answer. But you know what? It can make it worse. It scares you even more, so you tend not to think of it, put it to the back of your mind. So theoretical knowledge is not enough on its own. Your daily experience of complications and how you manage them all promote a much safer practice. I watched a video by Dr. Tim Pierce and it made sense as to why I was so anxious. I realised I would not be the only one thinking like that. I received lots of messages on our Facebook support page, really worried, scared, anxious. Is this a bruise? Is it an occlusion? Help, what's this lump? What should I do? I'm scared, I can't sleep. Will I lose my registration? It's like expecting something bad to happen. You know, like when you read a book or it's a scary film, but actually nothing scary actually it happens. You know, it's the thought of it, the anticipation. Your mind works overdrive and makes your anxiety worse. Fear of the unknown. I did not know all of the things that could go wrong. What should I do? So how could I change this anxiety and help others? Be more knowledgeable, make a difference. Share my experience and knowledge of aesthetic complications with the delegates I teach. Avoid, recognise, manage, knowledge, competence and confidence. Make complications a priority. I've used this knowledge to pass on and help you on our complications course, and it covers all aspects of aesthetic complications to help you understand it. There might even be some that you're not aware of yet, like stroke, visual loss, anaphylaxis. For instance, did you know what a biofilm is and how it can affect the healing of nodules and lesions? Have you got your protocols in place? There'll be a practical demo of how Hyalase dissolves filler. There'll be small written tests throughout the day. And I don't expect you to lose all anxiety, as I think a little anxiety is a good thing. It makes you a safer practitioner. I don't claim to know everything about complications, but I am passionate about trying my hardest to be the best I can be and pass that knowledge on. So Deja Vu's aim is to make you more understanding and able to recognise and manage and treat these complications. Be aware of every aspect, giving you a sense of control and confidence within your daily client treatments. Okay, experience and lessen the risk. So, master these complications and your fear of the unknown. Be certified in mastering them. Obtain 7 CPD points towards your revalidation. Keep your patients safer and take care of them in any possible eventuality that may occur. Make sure your patients and clients know how hard you are working to make their treatment safer and that you have their welfare at heart. Include complication risks on your consultation, but state that you know how to safely manage them if it should happen. Display your Mastering Complications certificate with pride and tell them what it means. I hope this helps you all. Thank you. Goodbye.